So this is the panel session on the blueprint for tomorrow, the role of policy and research in shaping. Today these panels, we are going to discuss about cutting edge research and the policy making in the field of early childhood education. Our panelists will discuss recent findings and innovation in ECCE can inform the transform policy at various levels. Our key panelists are, I can introduce them and they come on that. Mr. Sampath Kumar, he is the Principal Secretary and Development Commissioner, Government of Meghalaya. He heads Department of Women and Health, Women and Child Development, Health and Education. He is a member of Indian Administrative Service and holds a degree in Electronics and Communications from Vanya University and also Master in Public Administration from Harvard. Mr. Sampath Kumar, can you come? Second panelist, Professor Kanvi Panda. She is a professor and head Department of Non-Formal Education at NIPA. She is also heading Shiksha Shalas, a major initiative of the Government of India at NIPA. Mr. Panda. Our third panelist is Dr. Rita Patnaik. She is Joint Director at National Institute of Public Cooperation and Child Development, Ministry of Women and Child Development, Government of India. She has more than 2 decades of teaching research experience in this sector and she holds a PhD degree from Delhi University. Please, ma'am. The moderator of the session is Dr. Shmisha Anuja. She is education specialist at UNICEF India. She holds currently Early Childhood Education Center at UNICEF. She has more than 15 years of experience. Welcome, ma'am.
What I'd really like to start this panel discussion by saying, in the morning, Abhimanyu made a very important statement saying, if we're talking about a Viksit Bharat, we have to also look at a Shikshit Bharat. The Ministry of Women and Child Development has also acknowledged that while we are focusing on nutrition, we also need to focus on learning through its flagship program called Poshan Bhi Padhai Bhi. So there is a lot that's happening in the ecosystem. Somebody did mention this in the morning. We have 14 lakh Anganwadi centers in the country, which are serving communities in the most remotest areas. And there are more than 8 crore children who are receiving services from these Anganwadi centers. So how are we building those brains? How are we building the future of this country? Through these Anganwadi centers, through the preschools within our country. So through this panel, a very esteemed panel that we have here, we have both national and state level experiences across all panel members here. So we try and understand from each one of them what is happening in their agencies or how they are leading some of the work that the government has come out in saying is a big priority for us. And I'd like to start this conversation with you, Dr. Patnaik, at NIPSED being one of the key agencies of the Ministry of Women and Child Development. We know that, the ministry has been supporting the 14 lakh Anganwadi centers. We have a very comprehensive early childhood development program. Can you please share with the House here, what are some of the priorities of the ministry in terms of that really contribute to this theme of building flourishing futures, building the brains of young children in our country?
Thank you so much. Thank you, Reliance Foundation, for giving me such a great opportunity to be here. In fact, it's going to be a tough session after half the song and dance what we had now, and coming into policy and then research. Anyhow, from National Institute of Public Cooperation and Child Development, and I'm very happy to be a part of it. Why? Because next year ICDS will be completing 50 years, right? And what an opportunity to speak about ECCE in the 50th year. And mainly the journey had started from Balwadi, 1975, till Saksham Anganwadi. Or we could even tell that Poshan se Padhai tak ka safar. So many things could be added to it. And I think the ministry has gone a long way in this journey from 33 blocks of ICDS to 7,076 blocks across the country with 14 lakh Anganwadi workers, with 785 DPOs, with 7,076 CDPOs, nearly 38,000 supervisors in place. I think so the largest, biggest network what we could have across the world, and that too for promoting early childhood care and education. And ministry has been doing a lot. We had a ECCE policy 2013, and we had got a curriculum also, right? And then we are now in 2024. We have come with two major documents, that is Navchetna, the National Framework for 0 to 3 years education, and we have come up with the national curriculum for 3 to 6 years for the Anganwadis. I think so it is a great achievement. And in 2024, we have also got many other guidelines. It could be your PALMA, right? It would be your disability protocol. And we have the major program, what you said was Poshan B, Padhai B. And since I lead both the Poshan B, Padhai B and the national curriculum, I think so it was a great opportunity for me to put together research, policy and action together in one platform. Coming to Poshan B, Padhai B, last year it was launched by the Honorable Minister in May 2023. And through Poshan B, Padhai B, I think it's the first initiative in the country where we are planning to train the entire ICDS machinery. That is DPOs, CDPOs, supervisors, block coordinators, Anganwadi workers, everybody being trained into this important program of Poshan B, Padhai B. Of course, Poshan is there from 1975 onwards, but now from Khichdi centers or nutrition centers, we further think of developing our Anganwadi centers into vibrant ECCE learning centers. And for this, NIPSID has been given the charge of overall training and capacity building of all the ICDS functionaries across the country. We have got a two-tier approach mainly. NIPSID training the master trainers, that is CDPOs and supervisors, and first time in the country, I think so it will be the CDPOs and supervisors who will be imparting training at the field to the Anganwadi workers on a 3-day program, Poshan B, Padhai B. And Poshan and Padhai certainly go together. Dr. Vibha, in the morning you were talking about the brain development, neuron development and other things. We certainly know that nutrition and education, they go together. Even, during in the 7th month, after completion of 6 months, when we talk of complementary feeding and we talk of Annaprasan and other things, and we started with a sleep, right? So I feel that, from that time, automatically it's during gestation when these developments take place, but from the 7th month onwards, if we introduce the right kind of complementary feeding, it could be sweet for the first time, but why not? It could be also many other micronutrient-rich foods which could be introduced to the child, for which, it includes both Poshan and Padhai and the trick of how, to get the child to the right track. So, this is the 3-day program of Poshan B, Padhai B, which is being implemented throughout the country. Already on Poshan B, Padhai B, we have trained nearly 6,800 SLMTs in India, already across 32 states, and now we are ready for the Anganwadi worker training, and the Ministry of Finance has already rendered a 476 crore budget for the program on Poshan B, Padhai B. And with Padhai taking so much of into it, we will certainly try that the Padhai component is well taken care of, because Poshan is already being taken care of. We have got a Poshan tracker, and now Ministry is thinking of integrating all the ECCE indicators into the Poshan tracker. I think so that would be one of the greatest achievement for the Ministry, because apart from Poshan, even the ECCE indicators would be included on the Poshan tracker, and that would be of great help. And through the Poshan tracker, we are capturing so much of data. And I think so real-time data, once we start capturing from on ECCE, especially if we capture through the Poshan tracker, that would be a revolution for all of us, right? And the other thing which is very important is the preschool education kit. Already 1,000 rupees was for Anganwadi centers, and we have now increased it to 3,000 rupees. Now, how well we use this preschool education kits, and what is the design, what are the things what they should purchase, and how it could be judiciously used, that is another determining factor for all of us. And Poshan B, Padhai B, ma'am. First day we have got a Poshan component where we are covering the CMAP protocol, which is the latest from the Ministry. We talk of malnutrition. Second day is the Padhai part, and now the Padhai part, it's more important that we are having a national curriculum with us, and we have got the national framework with us. For 0 to 3 it is the framework, and for 3 to 6 it is the curriculum. So both the things are at hand with us. And now the main thing is the integration of national curriculum framework, portion B, padhai B together, so that it would make an impact. 3 days program is not anything. I won't say that the 3 day program will make a total change in everything, but it is only a beginning. And with so many people of all of us sitting together and speaking about ECCE, I think so that is what makes the difference. And once this ECCE, it becomes a social mobilization kind of a thing, or a Jan Andolan kind of a thing, where even parents, caregivers, everyone do understand that how important is this 0 to 6 years. And it's not only the Anganwadi, it is not only the school, but it is the entire 24 hours or the time which the child spends. Everything is a learning experience for them. And when we are cautious about it, we know that whatever we are feeding to the child is making or shaping the child. I think so that will make a difference. And Portion B, Padhai B, the national curriculum for framework, and national curriculum, the framework, all of this together will make a huge difference. Thank you.
Thank you, Deepaji. I think, the fact that both these things are important, and the fact that the ministry acknowledged that it did need to work towards changing the impressions about Anganwadi centers, which were often referred to as Khichdi centers, that these are centers, these are platforms through which children will also learn and will be school ready before they go to school. And we really understand, the scale from the numbers that Rita just mentioned. The scale is huge, and therefore it's not alone for the government to be doing it. I think all of us will have to be part of this Jan Andolan to support this change that is intended to be done at the Anganwadi centers and revisioning these Anganwadi centers. I'll now move to Dr. Pranati. We know that we have a new national education policy. And for the first time, the new national education policy, the school education department has acknowledged the need and importance in terms of including preschool classes within school. Some of our school education enrollment data, if you look at the government school enrollment data, 50% children coming to grade 1 are still coming without any preschool experience. And if they don't have the preschool experience, they don't really have the foundations for learning, literacy, numeracy, and other things. So I'd like to ask you, Dr. Pranati, that for school education, for having taken up this responsibility of adding preschool classes to schools, what are the kind of preparations that are happening both at the national level, and if you are aware of any specific examples that are taking place in some states, if you could share that here, that would be very helpful.
Thank you, Dr. Sunisa. Good afternoon, everybody. Let me say, I'm representing the National Institute of Educational Planning and Administration. We support Ministry of Education. It's a lot of policy development, also strategic planning for effective implementation. Let me respond to your question in a very different perspective. I think after 75 years of independence, now we are looking at the childhood through different lenses. I think this policy has brought children to the center stage in the education sector, what Sunisa mentioned. So the changing profiling of the children is seeking attention of the education sector. And another point what policy is emphasizing, the universalization of early child care education means we have to bring all the children to the pool of this pre-primary, early, or you can say early childhood education. It has been continued as a neglected zone. So thanks to Relax Foundation for bringing this topic in a very right time, and we are at the right juncture to focus on that. So the critical role of what Dr. Patnaik's spoke, it's the role of the Women and Child Development Ministry. Now the Ministry of Education is largely focusing by establishing institutions through multimodal approaches, either co-locating, that means shifting some Anganwadis to within the school, or giving enough facilities, keeping in view the distance, learning opportunity, and many things. Friends, just I want to mention that along with the universalization of early learning phase, or we can say the foundational learning, we need to be taking care of the equity and inclusiveness. That means these two concepts are guiding us the kind of ecosystem we want to create within the school education sector. And friends, all of you know that we have that 1.51 million diversified schools. There are small schools, there are very big schools, well-resourced schools, and also deficit schools. And when I'm looking at, there are many states taking initiative, which I would bring that point in the left part. But when I'm looking at the school as a learning organization or a dynamic institution, how prepared these schools are to integrate, locate, or institutionalize the early ECCE in the school education system. That's the very biggest question. So I'm looking at from the macro perspective and also the micro perspective. So I will begin with the micro perspective. The first point is the preparedness of the school. And also looking at creating that kind of infrastructure within the school to address the need of the young child within that school premises. There are many initiatives taken by different states. Possibly we are in the beginning phase. There is nothing to criticize rather than to facilitate how we can effectively institutionalize that. Many states are taking initiative, but when you look at the schooling processes, practices, aligning and addressing the need of this preschool education, possibly we need to give much more interventions. So what exactly we need to do to bring play-based education, integrating music, and what ma'am was also suggesting for the children. How do you do that? Do we have that kind of human resources? When I'm talking about human resources, the teacher agency to manage this, possibly somewhere we have, possibly we are not. Like when I was looking at the database in India, very less number of teacher training institutions are available who are preparing the teachers for preschool education. So where we would bring this human resource? And when I'm looking at one end of spectrum, Anganwadi workers to teachers, and also the very professionalized teaching community to manage this sector. So India has to go for a very long way to invest on human resource. They have to translate all these recommendations in true spirit within the school. When I look at, I will just flag one of our evidence-based research, how schools are improving and how it is supporting the school to prepare themselves to address this kind of needs. So one of the program we managed at the national level with the support of Ministry of Education, that is National Program on School Standard and Evaluation. So schools were looking through their own lens what is working within the school, what is not working, and it was also supporting school for incremental improvement. So when we consider school as a dynamic organization, it has to improve incrementally and sustainably, so that we require some kind of framework for a school to institutionalize ECC effectively. That is one of my major recommendations. And also institutionalize the kind of pedagogic practices we are recommending. How do we invest on our teacher agency to bring that kind of practices within the classroom? Because childhood children cannot be negotiated in any form with any deficiency. So what kind of humble beginning we could make so that our Indian children are getting right kind of, so to say, learning space or learning opportunity what policy is recommending. But when I'm looking at the systemic level, whether the national level, we have many documents frames. We have national curriculum framework now, and what she mentioned, we have some guideline, some policy, but exactly the kind of framework we require to institutionalize this concept effectively, possibly that kind of document is missing, with infrastructure guideline to the process guideline to the practices linking to the outcome. And also I'm looking at the states to map out this children population who are coming, who would be coming to participate in the pre-primary education. That kind of mapping is not done by many states. Along with that, the similar framework each state should develop, how they are going to institutionalize, and also the timeline for bringing all children for the ECCE. So friends, we are making humble beginning, but we know the education, school education is operating in a very, very hierarchical system. Somewhere it is happening in a great way, somewhere it is not happening. So how do we make it more sustainable and giving enough opportunity for the holistic development of the children as mentioned in the NAP? Thank you so much.
Thank you, Pranati. And I think there are two issues from what Pranati has shared that I would like to flag. One is the need for professionally qualified human resource. The younger the age group, the specialized the work it is. And I think we need to all acknowledge the fact that, one, we need to focus on the status of preschool teachers in our country. It's one of the hardest jobs to be done. We need to really invest in the institutions that build these professionals. And the second point that you raised, and I think that's a very critical point from a school education perspective. We're all talking about play-based learning, and some of our experience as UNICEF working with some of the states, since school education has not done play-based learning, it's becoming a little challenging for them to think of what kind of preschool education should be offered to children. And often grade 1 and 2 curriculums are now seeping down into preschools, where the focus is on get children to learn ABCD and 1 to 100 very quickly, which is not really correct, which is not developmentally appropriate. But steps are now being taken. There is a lot of work, there's a lot of technical support that's being provided to address these things. But I think from this national picture, let's move to what the state is doing. And through Sampath, I think what we'll get to hear from him is an example of a state and a state's commitment towards young children. So Sampath, I'd like you to share with the house here what has been the motivation of the government of Meghalaya and from the highest levels, as I know, to focus on this, on young children in the state.
Thank you, Subisha. First of all, while coming to this conference, Eli was accompanying me, and I saw the message of Dhirubhai Ambani, what everyone should have bigger dreams and bigger aspirations. So when I looked at it, in fact, Meghalaya, it's a beautiful state. It's a small state, but with a lot of aspiration to become a developed state, and with a lot of aspirations. I also wanted to say this. I think you're all aware, India is the world's largest population. So if you put the India as a in fact I would say I think you might not be able to see the presentation is there. You can see if you place the population, it will look like a pyramid. So that down below what you see is the children. So you have a huge number of children in the population, and if you come to the Meghalaya, the broad base is even more because our total fertility rate is high. In fact, one of the highest in the country. So we are looking at as an opportunity, not as a problem. Having younger population is an opportunity we found, because if you look at the globe, if you see all the OSCE countries, they're suffering from lack of, caregivers, because, there is an aging population, but there is no one to, take care of them. But whereas, India has the strategic advantage at this moment of time. And we, in fact, Meghalaya, if you ask me what is the motivation, we wanted to really build that cognitive capital, so that they will become the future workforce, and in fact they can really bring that strong economy to the state. So that's one of the main motivations for us. So coming back to like how actually we started the journey, I wanted to share it with you. We actually, in fact, we started ideating this in 2019-20, just before the COVID. We were looking at different developmental indicators. If you look at, I think most of you are educationists here, the learning outcomes. So when we saw in Meghalaya, the learning outcomes are very low. In fact, we are one of the bottom, 5 states in terms of learning outcomes. We also saw the maternal mortality rate is high. In fact, every year, over 230 mothers used to die in the state. So how can we actually prevent those deaths? Children, IMR, infant mortality rate is high. And we also saw that the stunting rates are high. National Family Health Survey, which 2019, it shows that Meghalaya has the highest stunted population. So we saw all these things are interlinked. Stunting is interlinked with learning outcomes, and everything like maternal mortality is again interlinked with lack of birth spacing, because there is no birth spacing, because at least you need to have 1,000 days of spacing between one child to another. So we felt that we need a systemic intervention that would address all the problems, all these I would say multi-dimensional and problems, or some of them are intergenerational problems, because it's a it's intergenerational problem, because how to tell a rural mother to tell that right to birth spacing is an important thing, because they may, so it requires a different kind of an approach. So we started saying, then we designed this one, and because the science of early childhood is a very, very interesting. If you ask me, if India has to invest on one thing, they have to invest in science of early childhood development, because as the Nobel Economics Prize winner Heckman, popularly, he did this study. Like for every $1 we invest, we are going to get almost like a $17 return on investment. So it's a beautiful investment, and also this investment, every mother, every parent wants to keep that investment. It's not that something, it's not like a online trading where I would invest only in this company, because every parent, the child is so important. So I think that's where we felt, I think we will bring this entire comprehensive integrated mission by in fact leveraging the existing programs of the state, like what my co-panelist said, like we have this ICDS is Integrated Child Development Services program, which has been initiated in 1975. So we have we have the Anganwadi centers are there, we have schools are there, we have the National Health Mission, massive programs, where you immunize every child in the state, in the country, that's like a massive programs. So what we brought is that we brought a sense of purpose, a sense of that this is something that we all can do it, just like we need to channelize those resources and restore the purpose that we can actually do it. We can really build our state in a different way. So we are actually today, one of the important components of our early childhood mission is positive parenting. In fact, I was listening to my earlier speakers, they were saying that there's a need to coach the parents, on parenting. How many of them know? In fact, I asked this question in many interactions. How many of you know that the child's brain, almost 50% is already done by the time the child comes out of the mother's womb? Nobody knows about it. In fact, I'm telling you, everyone said 50%. So that means during that period, how the parents have to take care of the pregnant mother. How even small altercations, some fights in the family can affect children and children's cognitive potential. So making that kind of one of the components, that's why we designed this entire program. The idea is that we are working in 3 areas. One, the Anganwadi centers, in fact, transforming them and upgrading them into early childhood development centers, where giving them some extra caregiver. In addition to the Anganwadi worker, we are also putting some self-help group members. In fact, I'm learning this music and all, maybe we will introduce all these techniques there from this session. And we also have one component on what Dr. Vibha was mentioned, that entire caregiver, especially mental health, how to actually provide that one. So all these support systems, and also at communities. In fact, we are also engaging a lot of communities. Like we have a massive network of self-help groups in the country now. We are leveraging all that, women self-help groups and, village health council. We constituted village health council, a traditional institution, because out the tribal population, we constituted village health councils to implement this ECD, mission in the state. So, and at the same time, coaching the parents is another important area that we are working. So if you ask me what is the motivation, that is the motivation. Motivation is that really this is a great investment. In fact, I want to end this one. I think some of you might be aware of this Dr. C.K. Prahlad. Dr. C.K. Prahlad is one of the famous economists. What he said about the bottom of the pyramid. So, and in fact, India has really invested on the bottom of the pyramid. That's the poor, the large number of the poor, that 60% is the poor. When India invested on the bottom of the pyramid with the rights-based entitlement programs, over the last couple of decades and so, or 2 decades. So, what happened today? A large number of these sections have moved into the social mobility, if you call it social mobility, and they have become the key growth drivers of the economy today. Today, our economy is good because we invested in the bottom of the pyramid. So tomorrow, same thing. If we invest in this children today, we will see a different kind of a nation altogether. Thank you.
Thank you so much. I mean, you must have all guessed the passion that this champion on ECD has here. But we will ask him to tell us more details about the mission, how it's working, how he's collaborating in the next round of questions. Because I'm sure there are a lot of inquisitivities about how it's working. Back to you, Dr. Patnaik. You gave us big numbers. There is a lot to be done. And you started with the 3-day training program. We know NIPSID is the nodal agency for the Ministry of Women and Child Development. So, is there a roadmap that the ministry has developed? What are the steps that the ministry is taking? You have regional institutes. So, how are you planning to kind of take this vision of Poshan Bhi, Padhai Bhi and the implementation of the new curriculum up to the last Anganwadi center as well as to the last parent who accesses services of the Anganwadi center?
Truly said. it's only the beginning, and the huge numbers are very scary. But we are preparing a roadmap for ECCE in the country, and mainly for Ocean Week, Padhai, we already, as you mentioned, we had a 3-day training program. And for the next thing, the main happening thing is that we have 2 documents with us. I request all of you to go to the NIPSIP website and kindly download these documents. One is Adharshila. This is the national curriculum for 3 to 6 years, and it's very heavy document. That is why it has to be downloaded. And the second document is Navchetna. This is early stimulation for 0 to 3 years. And I'm thankful to all the internal committee members, Dr. Vivai, and Shubha ma'am, and many others who have contributed for these documents. A lot of learning has gone into it. And now the main thing is that all the 3 things, research, policy and action, coming together. So, National Institute of Public Cooperation and Child Development, NIPSIP, we have got 5 regional centers across the country. That is, we have got a pan-India approach. And since 1975, we have been conducting training programs for ICDS. Right? So, it is our domain area. And since then, we have got a job training course for CDPOs, in which it is a 26 days offline program. And in this, we give job training to all the CDPOs, and 1 week is dedicatedly covered for ECCE. So when I listen to the songs in the morning and all that, then I went back to my JTC again, because in that 1 week training program, we try to have all these things, including your music, your songs, and then in fact your indigenous toys, DIY toys. How do we make it ourselves? How do the children learn, and how do they actually learn by making these toys? So all these things are very much action oriented. And since 1975, we have organized numerous programs for Anganwadis, and including Poshan, including ECCE. And coming to the curriculum and the framework, as ma'am was telling about early stimulation, this booklet, it contains nearly 150 activities. We have planned it for from birth till 36 months. Please have a look at all these activities, because now it is the point of action which has to be actually considered. Book doesn't make any difference. But when the Anganwadi worker, she has got to go for home visit under Poshan 2.0 and Mission Saksham Anganwadi, she has to go for home visits. Earlier, when she used to go for home visits, she had only one thing, that she will give information about nutrition and the nutrition messages which were going for it. But now, since we have the framework with us and we have the month-wise stimulation activities, now through the Poshan tracker, once we have it integrated with the Poshan tracker, immediately the Anganwadi worker will know whom to visit and exactly how many years old the child is. And then she has the blueprint in front of her. If she is going to a 6 months old baby home, then what exactly she has to tell. What are the stimulation activities which the parents have to conduct? She has got some time with her which she can explain. If it is a 12 months old baby, what are the activities? If it is a 36 month, what are the activities? So now here is an opportunity for all of us, that we have got such a good framework with month-wise division of all the activities. And these activities, now we are thinking of converting them into videos. Because now everything is so much digitalized that even under Ocean Week, Padhai Week, we are planning to have nearly 80 videos, mainly on the ECCE component, starting from the goals and then the curricular learning outcomes, and finally when it comes to everything ends up with the activity. Right? What are the activities actually? What do you conduct to all the stuff? So we have got all these activities with us. These will be integrated. And secondly, what I would like to say is the Adharshila. This is a 3 to 6 year curriculum. This has been developed with a total of 36 weeks of active learning and 4 weeks of initiation and 8 weeks of reinforcement. That means in the entire year, now the Anganwadi worker has got a complete set of activities for the 36 weeks, exactly how does she conduct. The 4-hour ECCE in the Anganwadi center, which she will be conducting, having 3 blocks, starting with the initiation, then the activity and the reinforcement, and how that she divide this time of the entire 4 hours, what is given to her, can she make the best use of it? and it's a very different scenario in an Anganwadi center, not like a school, because children come flowing in throughout the year, right? Anytime they can come, and they need an initiation time to adjust to the Anganwadi to know how does it function. So the initiation time is very important. That will have a different set of activities, and moreover, the challenge is that to segregate children from 3 to 4, 4 to 5, and 5 to 6, and the similar kind of activity can be divided into 3 different types, providing them opportunities so that one activity a little bit higher level for the next and the next. So this becomes really challenging. And for development of the Adarshina and Navjitna, in fact, we had many activities with the Anganwadi workers, because it is ultimately the Anganwadi workers who are going to use these documents. It's no other use for anybody else. And that is why we have made it very simple, and we have taken all the points from the Anganwadi workers and the helpers as well. And the Anganwadi workers or Didis, what they said was that one of the main things which would facilitate them in conducting ECCE was the helper. Right? If she has to conduct multi-stage, multi-variation activities in the classroom, now it is the Anganwadi helper who has to take care of one sector, one wing, and then move on to the other. So now it's like the Anganwadi worker, the Anganwadi helper, and now with the coming of the Palna scheme, though it has not been universalized across the country, we have started in a few districts across the country. Now another big challenge is that even at the Palna or the creches, what we are thinking of, we have to implement even ECCE there. The next important challenge for us was inclusion of disability. Disability was one of the main things which has to be included in both the documents. Both the documents in this document has got nearly 150 activities, the other 150, nearly 300 activities, and we have made it a point that we have special provisions and activities for the Divyang children as well. We have got a disability screening schedule for the children at the Anganwadi center, so that at least the Anganwadi Didi, they know at least how to not diagnose, but at least to identify and send them further for reference. So that is another main part of this thing. Now the main challenge for the ministry is, first of all, Poshan Ki Padhai is already there in place. Right, we will be training all the state level master trainers by the end of this year, and simultaneously we wish to begin the Anganwadi workers training program. And this Anganwadi workers training program has to be conducted in the field, and so now we need the help or support of all of you, one and all who are sitting here, because training of 14 lakh Anganwadi workers is not a joke. Right, training of Anganwadi workers is not a joke. And that too on such a serious issue where we are talking of ECCE, we are talking of play-based pedagogy, we are talking of curriculum. For this room it's okay, but for an Anganwadi center, all these things does not work. It has to be put down in a very simplified manner. For that we have got videos, we are trying to upload it on the YouTube, and we have got many partner organizations working with us. We will be uploading. We are trying to create WhatsApp group. I think so. This is one of the best medium whereby you can disseminate information and other things on day-to-day basis. So technology we have to take in account. Under Poshan Ki Padhai, we are having a tech-based assessment where we are having pre-post all tech-based, so that we have a dashboard running. And for the Anganwadi workers training as well, we will have that, so that whenever the trainings are happening, the dashboard is moving and we know how it is going. Training itself is not important, but monitoring is the most important part. How well it is going. So at present we are having telephonic calls and other things to find out how exactly the program is going, whether it's really happening or not, and all the stakeholders here. I think so we will be moving forward together with the monitoring aspect, in which we would require support of one and you all, where when the Anganwadi workers training is just starting, and all of us together, we can make this program into a Jan Andolan, and with Poshan Pakhwada and many other events which the ministry is organizing. I think it is the best platform, so that we can go together. And the national curriculum and the framework, I would like to repeat that it is based on the National Education Policy and the NCFFS, the UNMOOC and the other guidelines which have been prepared by the ministry. We are in line with all those things. It is based on all these things. And education ministry, Ministry of Women and Child together, I think so. When we sit together, have dialogues, and we can see how together we can go on it. Co-location of Anganwadis and schools coming into Anganwadis or Anganwadi going into the school system doesn't make anything difference as such. Intent is only one, right? Intent is only one, that having good ECCE across the country, it could be anybody, it could be any stakeholder, parent, community, education, any other ministry. I think so all other ministries, 9 ministries should be partnering for it, for such a great cause that, as ma'am was telling about the story. So it's all with us that we have to just monitor and we have to see how the beginning is made and what the inputs, so that a beautiful story is built upon. And for the children who are going to Anganwadi centers, as we remember that, our first teacher, all of us certainly remember our first teachers. I think so the time will come when the children in the Anganwadis will remember that my first teacher was my Anganwadi teacher or my Anganwadi Didi, जिसने मुझे गाना सिखाया, जिसने मुझे साइकिल सिखाया. I think the Ministry of Women and Child is heading for all that. Thank you.
This is amazing in terms of the intent and the aspiration that's coming out of it. And I would now pass it on to Sampath, because this intent and aspiration is actually getting translated into how it will work and what are the challenges that we are likely to also face. So let's be aware of those. So if you can talk about, from your experience in Meghalaya, how you're bringing all these stakeholders together and what are the ways, what's working and what's still kind of a challenge.
So, in fact, as I mentioned earlier, state has immense capacity. State means country, states, they have immense capacity. So, what here, especially for early childhood development, what we needed is that many players are there. It's not one, player. So not one department. So here, WCD department plays a very important role. Health department plays a very important role. Education department plays a very, very important role. So it's and community institutions, community development. We have a community development department in that. So that's again, it plays a very important role. So what we felt, what was the way we designed is essentially, we designed using a framework called building state capability. So what is building state capability? Is that we come up with a challenge, a purpose. This is our purpose. This is what we wanted to Meghalaya. We wanted to invest in this particular idea. So there is a political supportability for that. So and then we started actually mobilizing all the departments, and so what we did, we actually have designed this mission as a collaborative mission of all the departments and all the stakeholders. So we have created a dedicated agency. In fact, I think there's one or two countries are there who have done like this. They have a dedicated agency for ECCE, anti-child development. So we also have created an agency, and which coordinates and supports all the departments. And we also, because this is a new subject, that's why it's very interesting. Even today, the previous 3 sessions, we really enjoyed taking notes of what actually the speakers are speaking. So it's such a new subject. So what we are doing is we're also learning. So to actively learn, we're also collaborating with the different technical partners. So for example, of course, I studied at Harvard. I studied a course called the Science of Early Childhood Development to Drive Policy and Innovations. So like that, we are Harvard Center for Developing Child, Jack Shankoff, and we also have at a state level, and in fact, NITI Aayog level, Dr. D.K. Paul and that team. And we're coordinating with everybody, WCD and everyone, and we also very good organizations are there. For example, here there's a Sesame, there Rocket Learning, a lot of organizations all are trying to do something in this space. In fact, they have their own strengths. So we are collaborating with the different technical partners. UNICEF, in fact, has introduced us to one of the profound interventions that are happening just here. Maharashtra, that is in Sevagram, so where 0 to 3 is RM program. So we are also tying up with them, and so we set up what we did. We also actually set up a Center for Developing Child in Meghalaya, essentially to bring this entire knowledge and to really go into that. So when you ask me, like, yes, the challenges is essentially these are the challenges. So to what is the challenge is collaboration, because government departments work in silos. So how to actually break those silos and bring them collectively and work together. So for that we created a mission approach, a whole government approach. And at the same time, one of the things what we're doing is we are leveraging the existing programs. Many times what happens for the states, how to bring the budgets. So what we are also saying is that if you invest, this is again where in fact in our state we are heavily investing in the human development interventions. For Meghalaya is #1 state in healthcare expenditure. So we spend about 9% of state budget on healthcare. We provide universal healthcare. So like that, we are also making sure that like if you invest in human capital, you will actually get better return. So a lot of policy advocacy is also required here to say that for every dollar that you invest here, you get actually 17 times of return. Which investment actually can give such kind of return on investment? So we keep talking about it, and that way we could able to get that enough budgets and resources. And we're also working with ADB, Asian Development Bank, who actually are providing we're taking a loan from them. So like that, we're trying to build the resources. And what I just want to tell you, it's very easy. We have a program, a large-scale program in India. It's called the National Rural Employment Guarantee Program, where you can use the money to construct Anganwadi centers. You can upgrade Anganwadi centers. So we are using that. We are channelizing the NREGA resources to Anganwadi center constructions, like play schools. And we are using NRLM, is a National Rural Livelihoods Mission. So again, a large-scale women empowerment program. It's called Women's Economic Collectives. There's a huge. So we are using that network for actually, we are training them as ECD educators. So they are helped with both within the community and also at the center in the Anganwadi center. So we're also like that way, and again, we are putting a 0 to 8. So one, like what WCD has already brought up for 0 to 3 and 3 to 6. We're also building that one in a more contextualized into the Meghalaya, so state specific, what kind of stories to be told, so we are doing that. At the same time, what is the between that 6 to 8 is also another group. As Madam has clearly said, the challenge is how to teach a teacher who actually was teaching a different instruction. Suddenly he has to learn about the play-based learning. So a massive training and capacity building is required. So it requires a dedicated mission to do this one. Thank you.
Thank you so much. I mean, you're making it sound very easy. I know it's not very easy. And you spend a lot of your time and energy bringing just everybody together at the table. Pranati, my question to you is, and I'm picking it up from what Sampath just said. We need research and evidence, which will then help us for more policy advocacy. Somebody did this counting of that if you invest $1, the return is $17. And this has become such an important advocacy message for us to get more investment for this age group of children. So from your experience, and since NEPA looks at things at a national level, what are the kind of gaps in evidence that you see, or are there any important evidences that are already there that we should be looking at in order to inform policymakers, decision makers as to why we need to continue to invest? Because one of the things that I just wanted to flag here is our own analysis of budgets is that we are still investing only 0.1% of our GDP on young children. And as UNICEF, we at least advocate for 10% of education budget to be spent on ECCE. So I really want to hear from you about, what are the evidences that are available, or where are the gaps that we should probably, there are people sitting in this hall who could be looking at investing in creating more evidence about what works, what does not work.
Right, that's very important, significant questions. I started my job with the NEPSET. with 3.5 decades before. And the challenges, problems that time giving training to CDPOs and all that, making Anganwadi to perform better because of large scale it is still continuing. But when I look at the research arena particularly, we could see that because quite good number of our PhD scholars are working on ECCE. Looking at the one perspective, I'll go slowly, the convergence model. The convergence model, what Mr. Sampath said, how it is working. Whether Ministry of Education knows its role and responsibility clearly written down, as well as the Ministry of Women and Child, Ministry of Health. Where are they converging? At which point? So we could see overlapping, but there is no consensus at many points of convergence. Possibly we have enough fund from all these ministry. Somewhere we need to find the point where we need to invest in a rightful manner, because children are same for them, same for education. Right? So evidence-based research we need to carry out. Our research scholar, what they are finding is there are huge gaps in this. We call the convergence governance. So there are huge gaps persisting. Second, this area, particularly early childhood care and education, we have been talking about 80% brain development, 85% brain development. But we would find very less research in the Indian context. The research when our scholars, they do the reviews, they would all place the Western researches. Very less research done in the Indian context, Indian setting, though we know Anganwadi is operating for a long time and different model of ECCE are operating. Which model is really contributing towards the development of childhood and better learning? Possibly we don't know whether it is at the private sector or government or Anganwadi. I always call it, it's a joke, I always call it water tap model. That means when you open the water tap at Delhi, the flow would be huge. When it would reach to Ceylon, one of the very Thura region, at the school there, you would get a drop there. And that drop might not be accepted by many people sitting there. So possibly friends, bringing out all that document at the national level we are doing, but bit of evidence-based research. How much the teachers or Anganwadi workers, we have been calling them as workers, service provider, but we are making them the teachers. With a less meager amount of salary, telling them to deliver all the ECCE principles and practices in a very, very distressed situation, friends. We need to accept the truth. I think what he was sharing, some of the model ECCE Anganwads have been developed by the Reliance Foundation. So we need to look at the kind of model coming up. We need to do a lot of research in that work. And for example, it's a proven fact, magic, play, how it is working. I was really impressed to use the very folklore, culture-specific music, the lories, and many things. It should come up in a very big way. And friends, we need to have whether investment on teachers through capacity building is really making change. the impact of the in-service training? Answer would be yes, but to certain degree. What alternatives, pathways possibly we could bring out through our research? These are the area to be developed. And I look at if there are many kind of innovations happening in the Anganwadi center, within the co-location school, already private school, or any government school having the should be collated and shared somewhere. We must know what is working for our children. Thank you. Thank you, sir.
Thank you so much for bringing out some of these very important issues that we really need to understand the Indian childhood, because the Indian childhood is also very diverse. A child living in a tribal hamlet, a child from a migrant family living in an urban slum, each of their childhoods are very different. So we need to know that. We definitely need to look at the whole capacity building, professional development pillar that we have, what works. We're now moving so much in terms of using of technology. How is that? How effective is it? In order to make it more effective, what needs to be done? So yes, there are a lot of areas of research that we really need to look at, understand. And yes, the starting point is through knowledge management. There is a lot of experience sitting here in this room as well as outside. And maybe we need to start documenting what's working, what's not working, what are certain positive deviance cases, why something is working in a certain situation. And perhaps that's the way we need to get to start and then get to investing a lot more in terms of research. Thank you so much, and thank you to all my panelists. We've managed to do it in time, we've not overrun, and I think everybody will be happy because then we can go for lunch on time. I'd just also like to tell you all that Mr. Sampath has a set of slides which we could not show here, but we will share those slides with all of you to understand this Meghalaya ECD mission, because I think this mission is something for all of us as a country to learn, that how does a government invest and gives its commitment at the highest level to invest in the young children of our country. Okay.
Snatching some time from Sunisa, friends, there is a very critical recommendation in the NEP about setting standards for the school education. And there are a lot of learning points what we manage a program, Sala City, for a decade. With a lot of research investment and development, possibly all of you can Google that and look at the similar kind of standards could be set as part of the research parameter for the ECC sector as well. Thank you, sir.
Thank you so much. I hope you all found this discussion useful, and we'll probably go and look for more, around what's happening with Anganwadi centers in your own areas close to where you work. And thank you, Reliance Foundation, for organizing this really good panel that we all had to hear some very, very interesting thoughts about. Over to you.